Thank you, ladies and gentlemen. First, I would like to thank you, Sans, and Singh for this wonderful gathering that we have here, and the lectures that are being presented. Dr. Ahmed asked me to give a lecture about review of literature, and just outside, before we started this session, I was having a talk with Hassan on how when we were in residence, we just went to the PubMed, put in a few words, and whatever came out, we just said, well, there it is. That's our review of literature. And when I took my memory even further back, when I was a medical student, and I was trying to conduct a study with one of my relatives, she was a biochemist, I didn't have the closest clue on what I was supposed to be doing. And then I was just, I'm sure none of this generation knows the dot matrix printer that made so much noise. And we kept just printing out all these abstracts and reading half of them maybe, just to try and come up with a study. So review of literature, like you heard from the previous lectures, is the first step. It's you knocking on the door, whether you want to just do a review of literature, you want to design a study, you want to validate any recommendations that are out there, you have to go and check it out. So, like the rule we always say to our residents, when in doubt, check it out. So this lecture is going to be hopefully a framework that will help you in how to conduct a review of literature. Rudyard Kipling said, "I keep 6 honest serving men. They taught me all I knew. Their names are what and why and when and how and where and who." And this is the essence of any kind of research or study that you want to do. You have to formulate the question. And the question is the essence. It's the seed that you plant to have your study grow into a tree. So what is a review of literature? It's a comprehensive study, interpretation of the literature to a particular topic that you are interested in. And why is it important? Because, like my colleagues mentioned before, there are a lot of information out there, and you want to validate, you want to summarize. This is a very famous study that was done in London. Wakefield and his colleagues published a topic about 25 patients whom they claimed that giving mumps, measles, and rubella vaccine resulted in autism. And you can imagine how the media went berserk with this. And even later on, they found that the amount of vaccination went down from 90% in that area to as low as 44%, just because of that study. Because the media took that study and said, oh my God, MMR is causing autism. Later on, Dimitrov, in 2006, he did a review of literature and found out that there was no link whatsoever. So sometimes one study can be misleading into the practice that you want to adhere to. There is so much available information. This point has been pondered on before in the lectures before me. And the reason behind there's so much information is the information technology we have at hand today. You can do right now a review of literature while you're sitting there with your iPad. But the more important reason to why there is so much information out there is because we cannot accept an expert opinion anymore on any kind of fact or recommendation without having evidence-based medicine. And this was emphasized by my colleague Dr. Mahir Hassoun in the previous lecture. So there's so much information out there is because that we are in need of evidence-based medicine to guide our practice, and it's becoming more accessible to us. Who should do the review of study? Well, anybody can do it, right? anybody not anybody should do it, but you can do it. And at whatever level you are, medical student, resident, consultant, professor. But there are particular examples that I put here. When you're writing up a protocol and procedure for a hospital, you need to go back and review. Should the nurse go with the patient into the room or should she not? Where should the handover take place? You have to review these things. Guidelines, and we have the famous guidelines from the AANS for head injury and for spinal cord injury. How did this come about? By reviewing the literature and the strength of each study that was in the literature. And the most recent thing that they have done, which was a surprise, is that they revised the spinal cord injury guidelines, and they have changed now once and for all that giving steroids for spinal cord injury is actually harmful. Up until 2006, they used to say it's controversial, we don't encourage it, but if you give it, no big deal. But now this has changed. And always remember, when you're reviewing the literature, when you're writing guidelines, this has to be updated at least 2 to 5 years. When you're writing a case report, oh, I've never seen this case before. Well, how do you know? Maybe people wrote about it, so that's validate you to write a review of literature. When you're writing about contributing factors of an entity disease or preventing factors, again, these are just some of the examples. And now to the how. How do we do a review of literature? I summarize this in 7 steps. The first one is to identify a research topic. What do I want to talk about? And then to identify your research question. Define that question, refine that question, and keep reminding yourself about that particular question, because you don't want to be sidetracking. Then develop a systematic approach to searching the literature. How am I going to search the literature for the question I have at hand? Critically appraise the collected literature, like Dr. Maher mentioned earlier. Then synthesize these findings, discuss these findings with colleagues, take the positives and negatives of your findings, make recommendations on how to refine your report, and then write it down or write it up. So let's move on. Identifying the research topic. If you don't have a genuine interest in that topic, then you're wasting your time. So always remember, I have residents who come up to me and say, I want to write a paper with you. So I say to him, well, I'm interested in doing oncology. They're not. So what ends up happening? We don't do anything. We don't even go beyond the research topic. So if you don't have a genuine interest in that topic, you're just wasting your time. The source of the topic can come from the incidents that you have in your daily practice. So you're doing, your rounds and you're discussing cases with your doctor, and a particular thing that happens, and you say, this is very peculiar incidents that happened. So I wonder if this happens to other people. So that would be a source of where you can formulate that question. So you have to go read widely about that topic before you dive into it. Discuss the ideas with other colleagues, maybe even write to the authors who wrote about this case report or this review. Outline your ideas, your resources, and the time frame that you want to write up your review. Because you don't want it to linger on forever and all of a sudden you lose interest and you lose the momentum. Make a mind map of what you want to do. And keep a diary. I mean, this is something I read in a book 2 nights ago, and to be honest, I haven't done it, but the way he explained the author is that you're keeping a diary of every step that you're making along the way about how you're doing the review. And the interesting thing about it is this will help you sometimes, to go back to those little details that you miss out in your scientific resources, but also this will help guide you when you're starting up to write another review. So you'll see what kind of step that you have done. So I find that quite an interesting tool. Now, identifying the question. Now, keep the question simple. Don't make it a sophisticated, out-of-this-world type of question. Because this question, once you have that review of literature, will help feed back into the practice. Avoid vague questions, avoid broad questions like, what is the cause of cancer? I mean, that's a very broad question. You cannot answer that in a review of literature. And undefined questions, what is the meaning of life? Oh, come on, I mean, be realistic, okay? And structure, the whole literature is going to be built on that question that you are putting down. Sir, sometimes you cannot formulate the question, but you have an interesting topic, so you explore that topic and explore the areas that have not been explored, or the questions, or the contradictions. Like, there's a famous book on the controversies in spine. State your question as a question. Maybe that's the same as the first one. And avoid leading questions. How you are leading the questions. You say, how do we improve the attitude of residents towards doing research? Well, this is a leading question because we have assumed that the residents have a very bad attitude towards doing research, which I'm sure is not true. So don't put your assumptions into the question. Keep the question neutral and answerable and realistic questions. So don't make a question where, what is the incidence of subarachnoid in space? I mean, come on, that's not going to work. That's not realistic. I mean, how many people go into space and have a subarachnoid hemorrhage for all we know? So these are just a few points on how to formulate a question. And then you have to refine your question, because you have to know you are not a prophet where you're getting the message from God, so once you have a question, it's the only question. No, you have to refine it along the way. So first thing is just test the waters, put the questions, go and look at the literature, see how much information you can get from that question. If the resources are too little or too long, then maybe you have to refine that question to have it more focused. If you're working on a small-scale project, they usually recommend that you have at least more than 6 and maybe less than 15 articles to review. That's for small-scale projects. Remind yourself of your questions, because you will always stay focused. So take a little note, post it, and just stick that questions everywhere you go, on the mirror, in your car. No, not in your car, because you might be driving and you get distracted. Everywhere you go, just stick that question, so you keep reminding yourself about the questions at hand and how am I going to do the review of literature on it. A constant reminder. Now, a systematic approach. Linus Pauling wrote a book called How to Live Longer and Feel Better in 1986. And he quoted many articles and many studies about the value of vitamin C, especially in the common cold. This book was a bestseller at that time. Years later, about 8 years later, Nipschild, argued that the articles reviewed in that book were biased because the author only picked the articles that are agreeing with his point of view. He didn't do a systematic review of all the literature available at the time. And always remember that the resources and the articles available are not necessarily have to be only the published articles, because there is also a bias in publication. People want to publish whatever that is working, They don't want to publish an intervention that is not working. So you have to bear that in mind. There are also other unpublished articles if you want to be a very extensive researcher of that subject. So you have to go to those unpublished articles. So always keep a balance and don't be biased towards the articles that meet your point of view. No, you have to be neutral to that. So a systematic approach is a concise summaries of the best available evidence that address sharply defined clinical questions. So the best available, not the correct, or not the one that I feel like it is correct, but the best available, you know, the very high evidence-based. The Cochrane collaboration, formed in 1993, is doing that job. They're conducting a review of literature for particular topics, and they're publishing it, and you can find it on the Cochrane Library. But they are very methodical, and they stick to a certain protocol, and it takes many people just to come up with one review of literature in a particular topic. So you can use it as a resource. You don't have to do your review of literature to the same standard as the Cochrane Library collaboration, but you have to at least adhere to the methodology and to stay in the frame of being systematic. Because unsystematic reviews can give you misleading results or conclusions. Now, there are the narrative reviews, which are just a glorified type of an essay, and you don't want to be falling into that because it will not be considered as a review of literature worth of quoting. Mulrow reviewed 50 review of literatures back in 1997, and he found with his colleagues about 49 out of 50, they didn't have a method on how they reviewed the literature, and they put inappropriate summaries. He concluded at the time that the review of literature was not based on anything scientific. That's why there was this shift in the way of thinking on how to write review of literature, that we have to make it even into a methodology. It's as if you're conducting a study itself. You have to mention and you have to detail how you went about to research your topic. Narrative have no focused questions, they don't have focused searching strategies, and they cannot be reproducible. If you ask two people to go and review what you've just reviewed, if it's not systematic, they will not come up with the same results as you did, because why? You didn't have a systematic approach towards it. So how do I do a search? How do I search for the literature? Well, you can first think you have to have a strategy on what you want to search for, and be careful not to be sidetracked. You're talking about one topic, all of a sudden you have all these literature talking about something, a related topic, you find yourself sidetracked. So don't get sidetracked. And resist the temptation, oh, I have to include this study, it's a randomized controlled trial, but it has nothing to do with your question. You just want to use it because it will make your review stronger. Resist that temptation. Stick to your focused question. Make an inclusion and exclusion criteria for what literature you want to review. There's a lot of papers out there. A lot of papers. I think I heard one doctor once say in a lecture that only about 30% of what is published is worth reading. So you have to try and find those 30%. So guided by the question, you have to make your inclusion-exclusion criteria. Am I making a study on adults or pediatrics? Am I including all languages on earth to review all these articles, or am I just sticking to English? Am I putting a time frame, meaning I'm going to start from 1995 up until 2005, or am I going to review anything that has ever been written? Unpublished data, like I mentioned earlier. And then you have to justify your inclusion-exclusion criteria in the methodology that you write up. The resources of literature, like mentioned before me, they fall down into four particular types. The first one is the most used, and Dr. Maher, mashallah, did much extensive links on his slide than mine. But now the electronic searching is the common place for us to look for any literature that we want to review. And this can be at Ahmed, Medline, PubMed, Cochrane Library. Searching the reference lists. You're reading a book, and then at the back there is this references, a whole whack of references about the articles of a particular topic you just read in that chapter. That can be a starting point as well. And then you can go and search each article in a particularly designated journal, like Journal of Head Trauma. You can just search all the contents of that head trauma journal, maybe you will find the articles that you have or you need. Or contacting the authors themselves directly. You know, they wrote this article, and then you can ask them, so what was your reference? Where did you read this about? What guidelines, what advice would you give? Keywords are very important because now everything is indexed with a keyword. So you have to make keywords of the questions that you are asking, because these keywords, you're going to use them when you go onto the engine and make your search. So try to brainstorm and come up with all the keywords that you think that they are relevant, that represent the essence of your questions. Think of synonyms: intracerebral hemorrhage, intraparenchymal hemorrhage. And don't have political correctness. This is not the time for it. Meaning, there's an example. Oh, can I write mental disability or difficulty of learning? Well, you know, back before 1996, I think, they were not saying difficulty. They were saying mental disability. So don't try to be shy. I'm not going to research that word because it's inappropriate. No. Back then is where we are here, based on the evolution of thought. So if you want to have your research broader and more elaborate, you have to use all those keywords. Different keywords are different in different countries. How many times did I say different in that sentence? I don't know. Thank you. So acetaminophen, paracetamol, you know, these kind of examples. And the strengths and limitations. The detailed and systematic search strategy yield more relevant references. State the limitations that you find. And if you have not read the original work, do not use it in your references. Write, I did not find any literature on X, rather than saying there is no literature on X because I'm Mr. Expert. Then the critically appraise of the collected literature. Dr. Maher Hassouna went over this, but I just want you to remember that there are two traps whenever we are reading an article. Some people tend to believe everything they read. You know, oh, he said that must be true. And some people think that whatever is written is wrong, and I'm going to have to find a mistake in that article if it's the last thing I do. Don't try to be in between, okay? Try to have the objectivity of reading the positives and negatives of each article. Because critical appraisal is what's going to distinguish your review of literature of being a review rather than just a glorified essay. Know your literature, identify if it's a quantitative or qualitative. This was covered. And the tools that you can use in your critical appraisal, what's being said, the author, how did they carry out the research. In quantitative studies, what's the journal of publication, what is the research question, the method is very important, how big is the sample, and the analysis of the collected data, so on and so forth. Tips on critical appraisal. Critique means giving positive and negative. There is no such thing as a perfect article, because if there are perfect articles, we will not need review of literature. Distinguish between papers, whether they are empirical findings or expert opinions, summarize. And then synthesize these findings. So you've collected the literature, you've criticized, did your critical appraisal. Now how are you going to synthesize these findings? You have to assign codes. Okay, this literature is saying that this disease will cause A. This literature is saying that there is no link, so you have to code it and then make a theme. And then identify these studies and document the gaps in the literature that you faced with all the literature collected. And then you have to write it down, coherent, systematic, clear, English, not Swahili, I hope. Follow your research question, keep an up-to-date and back up everything that you write down so you won't lose it and then you sit and cry. And this is a structured, suggested structure like mentioned before, the title, the abstract, an introduction, the methodology, which will identify your research question, its rationale and its origins, and how did you search the literature? This has to be mentioned to give it a stronger value, and then the result has to be mentioned. Discussion is the interpretation of your results, strengths and limitations, and then write the complete references, completely correct, so you won't be mistaken for that. And I think that's about it. Thank you.